Over the past 7 years, Ted Mitchell has overseen the Texas Tech Health Sciences Center as the president of the entity. In that time, he's seen a recession, the coming of the Affordable Care Act, and unprecedented expansion of the facilities. Because of Lubbock's geography, the HSC has turned into a hub for the rural areas of West Texas. And in this episode of In Depth, he'll talk about rural health care, how he came into his career, and he gives some advice to upcoming medical students.
How is it that you got into the medical field?
Yeah, okay. Well, my father was an ear, nose, and throat doctor in Longview, Texas. And so all my life I had grown up around medicine and had seen, and I always had a predisposition toward math, science stuff. And so by the time I was in high school, I'd spend time making rounds with my father and things of that nature. Now I've got 4 siblings. I've got a sister and 3 brothers, none of whom were even remotely interested in medicine.
Okay.
And so I was the middle child, and so as it turned out, my best friend, his father was also a physician, and the two of us wound up going to college together and medical school together. But I never knew what I wanted to do in medicine. I knew that I enjoyed it. I knew that I admired what my dad did, but I didn't want to be an ear, nose, and throat doctor. And so for me, as I went through medical school, my senior year of medical school, I actually took the LSAT for law school. And I selected internal medicine, my field, because it's a field where it's the diagnosticians, where you learn a tremendous amount. But you're not working on surgeries. You're not working on surgical skills that I would lose were I to go to law school.
So when you talk about mission, and when you also talk about healthcare, there's a lot of talk of the rising cost of healthcare.
Sure.
How is it that you go about, especially in a medical institution, teaching people the importance of trying to help, and trying to help the indigent, those people who might not be able to afford healthcare, especially now some people don't because they might have to miss work, or some people don't because they just don't know symptoms of whatever sickness they might have.
Well, let me approach it this way. When you look at the provision of health care in rural areas, where you have folks, some of whom have money, some of whom do not have money, and I'll use this, and this is not a political thing, but the buzz that you'll get from all the students and everything right now is about the Affordable Care Act, about what's called Obamacare. The intention with Obamacare is extremely noble, to make sure people have access to health care. The problem with the Affordable Care Act for rural America is that it was written in a very urban-centric manner, and this is what I mean by that. The idea was you had 25 million or so folks that did not have insurance. So the idea was, if we can get them health insurance, they'll have access to health care. But in rural America, the 2 biggest obstacles to getting health care, number 1, are a lack of providers, and number 2, it's our geography. Neither of those was addressed by the Affordable Care Act.
And that's what makes this school have flourished, because because there's not as much doctors around here, not as much practitioners.
Our challenges are different than UT Houston, than UT San Antonio, than UT Dallas. Our challenges are different. Our opportunities are different as well. So as a consequence, when we think of solutions for poor folks, middle class folks, and rich folks alike, we think of things like telemedicine. So if you have somebody that has chronic diseases, I mean things like asthma, high blood pressure, high cholesterol, diabetes, those are things that you can actually monitor them close to home. And so they don't have to take off work to drive in 2 or 3 hours to come in to see a doctor for a standard little checkup. So those are the areas that we focus on. We actually, a large part of our mission is to provide service to small clinics all over West Texas, so that those physicians that are out there, those practitioners that are out there, they can keep their practices open because we help them with their electronic health records in a way they can't. So a large part of what we do is try to keep these small practices healthy so that they can take care of patients there, paying customers and non-paying customers, without having them have to come to Lubbock or to Amarillo or to Midland, Odessa, or to El Paso.
Is that then a lot of challenge that newer doctors, newer practitioners face, is figuring out how exactly do we get paid, but also trying to help out people who might not be able to pay?
Absolutely. And one of the things that is wonderful in medicine is when it comes to provision of care, there are safety nets and safeguards put in everywhere. If you look at and this is one of the issues that the Affordable Care Act is trying to address. If you look at the poorest of the poor that have nothing, there's actually a great safety net for them with things like Medicaid. And then of course, if you look at people that are in the middle class and the upper class that have Blue Cross Blue Shield and Aetna and United Healthcare and other things, they have their insurance. The people that were in the squeeze were actually what they called the working poor. All right, so they made too much money to qualify for some of these federal programs, but they didn't make enough money to have the big Cadillac insurance plans. That's the group that you really have to focus on. People that are very poor, they have safety nets built in. People that then are, again, middle class and upper class, they can afford theirs. It's the working group that you need to help. So one of the things that we try to train our students about with this is the fact is you can actually practice when it comes to preventive care, when it comes to primary care, you can actually practice it relatively inexpensively. What has happened, and this is really your generation, the generation that has just grown up steeped in technology, if they're not very, very careful, they become absolutely dependent on everything related to this kind of stuff. Men and women coming through healthcare understand that the most important thing is your relationship with that patient. Because if you can get that right, you can minimize your use of technology for them. Save money for them, save money for the insurance company, save money for the system, and provide them high quality care.
Here recently, the Board of Regents have approved an expansion here for the Health Sciences Center. What is exciting about that? Why do we need an expansion here?
Well, I always jokingly refer to this original building as the Soviet-style building. And so you have Texas Tech across the highway with all this gorgeous Spanish Renaissance architecture, and then somebody that looked like a third grader came over here and drew this box. And now I'm sure I'm insulting somebody, some architect someplace, but we've outgrown our space. We're the largest health sciences center in the state of Texas. We graduate more healthcare professionals than anybody in the state, and we've just outgrown our space. And so the state of Texas, in the last legislative session, gave us funding for building expansion that we need, actually on several of our campuses. So we have an expansion project going on in Amarillo, we have an expansion project in the Permian Basin, and we have an expansion project here. For the one here, we're going to use this as an opportunity not only to grow the space we need for our students, staff, and faculty, but also to reroute some of our traffic patterns and other things, because the Health Sciences Center, the way the parking lots have been developed, the way the roads are placed in there, it's very confusing to people even to try to find where they need to be on the Health Sciences Center side. So we're taking the opportunity to reroute traffic and do other things to make it very welcoming, like on the Texas Tech campus.
So, working with medical students, and I guess this would be the last point I'd like to make, working with medical students, what's one of the things that as they go into their career, as they come into medical school first, that they might overlook, something that they never would have thought could happen to them, and that you always try to push them to know, that you always want people to be aware of?
Sure. Well, I would tell you two things. One of them is just a very practical thing, and that is that, again, you have highly educated students who oftentimes don't have some of the most basic life skills, knowing what a banker is for and what an attorney is for estate planning, all the things that they need to, some of them don't even know how to balance a checkbook. They've never had to do much of that. So certain life skills they need to understand as they leave here, that because they'll be earning good salaries, there will be that there is a need for them to understand some business, because medicine is, at the end of the day, a highly regulated business. All right. The flip side of that, which is the second point, is they can never lose track of the fact that they are seeing people at their most vulnerable. So when patients are coming in to see them, they're vulnerable because of illnesses and other things. And so the position they have in their community, the position they have in their church or their synagogue, their temple, the position they have with other families is one of great responsibility. And you cannot lose sight of that fact when you're working with people. It's one of the greatest ways to spend your life there is. It's a fun thing to have an educational background so that somebody can come in and you can play Sherlock Holmes and figure out what's going on with them and get them feeling better. That's a wonderful way to spend your life, but it is an awesome responsibility. And we tell the students this regularly. You're entering professions over here that require you that you hold yourself to a higher standard. And if you really can't do that, this may not be the profession for you. The fact of the matter is, the vast majority of these folks coming through are good-hearted, hard-working students, and they're going to make us all very proud.